Botox is a purified protein that relaxes muscles wherever it's injected. Botox is the most popular cosmetic treatment in the world. It's been injected millions of times over, and in experienced hands, complications can be kept to a minimum, and it's absolutely safe. Most people will use it primarily in the upper face. You can use it for the frown lines, you can use it for the forehead, you can use it for the crow's feet around the eyes, and you can even give somebody a brow lift. If they've got sagging sort of eyelids, you can give them a little bit of a brow lift just to open their eyes up a little bit. In the lower face, you can use it for the smoker's lines, you can use it for dimples around the chin, and you can even use it in the masseters to help reshape the jaw so that it looks a little bit more pointed in some people. One of the more therapeutic uses of Botox is actually to use it for hyperhidrosis. Sometimes people have a problem with sweating, and they'll sweat an awful lot, and you can use it in the underarms and even the hands and the feet. Depending on the area that you put it into, Botox will last anywhere from 3 months to 8 months, 8 or 9 months. In some areas, you're limited as to how much Botox you can put in because you don't want any complications. So typically in the forehead, I'll use a lighter dosing because you don't want the whole forehead to sort of sink down. And that'll typically last around 3 months. If you put it into the frown areas, which is a nice strong frown line, you can get it to last. If you use it regularly, you can get it to last 8 months. The most common side effect for Botox is bruising. Just where you inject it, occasionally you'll get a small bruise, but that fades away after 2 or 3 days. A more serious side effect is a droopy eyelid or a lid ptosis. That is something that I personally hate and will do everything possible to keep that side effect to a minimum. What happens is that occasionally the Botox that we put in through here in the frown lines will migrate and affect the upper eyelid. That will give you a temporary droop that lasts only about 2 weeks or so. For that reason, we'll tell patients, we'll give them very strict instructions not to touch that area for 4 hours after the treatment, not to put on makeup, not to put on a tight sunglass that might touch that area, and also to make sure that they don't work out. I used to let people work out, but sometimes if they're concentrating and a little bit of, a drop of sweat comes down, and they'll inadvertently touch it and push the Botox. The 3 products are actually quite similar. They all belong to the botulinum type A class. They differ in the molecular weight, rates of diffusion, and the dosing. Occasionally, if I need a product that if I'm injecting into an area where I want it to diffuse a little bit more, I'll inject a different product, but basically it's a clinical decision. I think that's something that you should probably discuss with your injector to decide which one is more appropriate for you. The idea with Botox is to reduce the movements that you don't want, but it's not to completely stop all facial expressions.